Good afternoon, Eagles. This is Officer Barr, your school resource officer. Today I'd like to present to you a drug awareness presentation. We're going to talk about some different drugs today. We're going to start with marijuana, and it refers to the dried leaves of flowers or stems of the hemp plant, the Cannabis sativa, which contains the psychoactive, mind-altering chemical drug that's named delta-9 tetrahydrocannabinol, or THC for short, as well as other related compounds. This plant material can also be concentrated in a resin called hashish or a sticky black liquid called hashish oil. Marijuana is the most common illicit drug used in the United States. After a period of decline in the last decade, its use has been increasing among young people since about 2007, corresponding to a diminishing perception of the drug's risk that may be associated with the increased public debate over the drug's legal status. Although the federal government considers marijuana a Schedule I substance, which means it has no medical or medicinal uses and high risk for abuse, there are 2 states that have legalized marijuana for adult recreational use, and 20 states have passed laws allowing it to be used as treatment for certain medical conditions. Although it may be legal in the 2 states, it is not legal in Texas. For possessing a small amount of marijuana for the first time, the penalty can be up to $2,000 fine and 180 days in jail. If it's on or near a school property, that offense is enhanced to the next highest level. Marijuana is usually smoked in hand-rolled cigarettes or in pipes or water pipes. It is also smoked in things called blunts. They're cigars that have been emptied of tobacco and refilled with a mixture of marijuana and the original tobacco. Marijuana smoke has a pungent and distinctive, usually sweet and sour odor. Sometimes marijuana can be mixed with food or brewed as a tea. When the marijuana is smoked, the THC rapidly passes through from the lungs into the bloodstream, which carries the chemical to the brain and other organs throughout the body. It is absorbed more slowly whenever you use it in either food or you drink it. However you ingest it, the THC acts on specific molecular targets of the brain cells called cannabinoid receptors. These receptors are ordinarily activated by chemicals similar to THC that naturally occur in the body. Marijuana also affects brain development, and when it's used heavily by young people, its effects on thinking and memory may last a long time or may even be permanent. A recent study of marijuana users who began using it in adolescence revealed substantially reduced connectivity among brain areas responsible for learning and memory. People who began smoking marijuana heavily in their teens lost an average of 8 points in their IQ between the age of 13 and 38. Marijuana is sometimes referred to as a gateway drug, and that refers to basically people starting off with marijuana and then looking for something to give them more of a high or actually more of a thrill, something a little bit stronger, and they sometimes progress on to either heroin, cocaine, or methamphetamines. All of these drugs can lead to addiction or death from just one use. Marijuana smoke is an irritant to the lungs, and frequent marijuana smokers can have many of the same respiratory problems experienced by tobacco smokers, such as a cough, phlegm production, acute chest illness, or a heightened risk of lung infection. Marijuana also raises the heart rate by 20 to 100% shortly after smoking. This effect can last up to 3 hours. In one study, it was estimated that marijuana users have a 4.8-fold increase in the risk of heart attack in the first hour after smoking the drug. Here's a picture of a healthy lung compared to a lung of a smoker. A number of studies have linked chronic marijuana use and mental illness. High doses of marijuana can produce a temporary psychotic reaction involving hallucinations and paranoia in some users, and using marijuana can worsen the course of illness in patients with schizophrenia. Associations have been found between marijuana use and other mental health problems such as depression, anxiety, suicidal thoughts among adolescents, and personality disturbances, including a lack of motivation to engage in typically rewarding activities. So please don't drink and drive, and let's not smoke marijuana and drive either. Some of the questions that they have for marijuana: is it addictive? Contrary to common belief, marijuana is very addictive. Estimates from research suggest that about 9% of users become addicted to marijuana. This number increases among those who start young and among people who use marijuana daily. Long-term marijuana users trying to quit report withdrawal symptoms including irritability, decreased appetite, anxiety, or drug craving, all of which can make it difficult to quit. If you have any questions about marijuana, you can get with your teacher. They can send me an email, and I'll gladly answer any questions that y'all might have. We're going to move on to some of the other drugs that sometimes marijuana will lead to. And the first one we're going to talk about is heroin, which is a highly addictive drug derived from morphine, which is obtained from the opium poppy. It's a downer or a depressant type drug that affects the brain's pleasure systems and interferes with the brain's ability to perceive pain. Some of the long-term effects of using heroin are collapsed veins, infections of the heart lining and valves, liver disease, or pulmonary complications. In addition to the effects of the drugs itself, street heroin may have additives that do not really dissolve, resulting in clogging of the blood vessels that lead to lungs, liver, kidneys, or brain. This can cause infections or even death of small patches of the cells in the vital organs. One of the other drugs that marijuana use can lead to is methamphetamine. Meth is an addictive stimulant that strongly activates certain systems in the brain. Methamphetamine is a crystal-like powdered substance that sometimes comes in large rocks. When the powder flakes off the rocks, the shards look like glass, which is another nickname for meth. Meth is usually white or slightly yellow, depending upon how pure it is. Methamphetamine can be taken orally, it can be injected, it can be snorted through the nose or smoked. Extremely addictive, and users can develop a tolerance quickly, needing larger amounts to get high. In some cases, the users forgo food and sleep to take more meth every few hours for days. That's called binging, until they run out of the drug or become too disorganized to continue. Chronic use of methamphetamine can lead to either paranoia, hallucinations, repetitive behavior, delusions of parasites or insects crawling on the skin. Sometimes users can obsessively scratch at their skin to get rid of these imagined insects. Long-term use or high doses or both can bring on full-blown toxic psychosis. This violent, aggressive behavior is usually coupled with extreme paranoia. Methamphetamine use can also cause strokes and death. Another drug that marijuana use can lead to is cocaine. And it's a stimulant drug that comes from the cocoa bush that grows in South America. The leaves are soaked and mashed and filtered to create a paste that is treated with chemicals, and then it's powdered out and forms cocaine. Crack is a derivative of cocaine. It's chemically changed so that it can be smoked and inhaled into the lungs. Particularly addictive and very dangerous. People are attracted to it because smoking provides a much quicker and more intense high than sniffing or snorting, like cocaine into the nostrils. The sudden rush puts the brain, heart, blood vessels, and other organs at serious risk of damage. Some of the short-term effects of using cocaine is a person's appetite will decrease. The person will have more energy and will not feel tired easily. The person will be more alert. The breathing will speed up. The heart rate and blood pressure will increase, and he or she is at a greater risk for burst blood vessels or heart failure. Some of the long-term effects: if cocaine is sniffed, the nose tissue will be damaged. Sometimes the lining between the two different nostril holes will be eaten away and will be non-existent. The person may be undernourished, and the person may get infections more easily. Cocaine is bad for the heart. It increases the heart rate and blood pressure while constricting the arteries, supplying the blood to the heart. The result can be a heart attack, even in young people without heart disease. Cocaine can also trigger a deadly abnormal heart rhythm called arrhythmia. And again, if y'all have any questions about cocaine, heroin, or methamphetamine, get with your teachers. They can send me an email and I'll gladly answer any emails or any questions that you might have.